explain. Their mom might actually take them to the eye doctor, but the eye doctors, who probably graduated like me without a big emphasis on binocularity, they'll go, yep, 20/20, 20/20, near 20/20, yep, great, no problem, doesn't need glasses, it's not an eye problem. But that's why it's so missed, because there are a ton of visual processes that are not part of a basic eye exam. And that's why in your handout, on that last page, that is why with every kid that comes into my office, I want the parents to notice, or even ask the kids, if they notice any of these little things, like, is it hard to keep your place when you read? Or is it, do they feel like the kids are spelling phonetically instead of using their visual memory? Or do they rub an eye because they're trying to clear things up, and even though they don't have any eye problems or allergies maybe, they're still rubbing their eyes just trying to clear things up? Or they might just kind of tilt their head and try to get their nose to block one eye just so that that other eye can do the reading. So there are a few symptoms you can look for, but they usually are not associated with, oh, you better go get your eyes checked. In fact, most of the time, these kids are said, well, we just need to do some more tutoring, and the more you practice reading, the easier it'll come, which is true. That natural eye development does occur. However, if you just keep practicing and practicing, but you don't have those perfect visual skills by the time you're taught to read, you're just going to start learning some compensatory ways to learn. Like maybe their hearing's great, so they'll just try to sound out every word, try to get through the day that way. But as everyone knows, if you're just reading and you're sounding out words and you're decoding and you don't have this beautiful movie going on in your head, you're not visualizing what you're reading, well, you're not going to remember anything you read.